5:30. Indiana lawmakers are working on legislation they say could help keep more moms and babies alive. WHS 11's political reporter Rachel Droz explains what they want to do and why experts say changes like these are needed.
Indiana ranks among the highest in the nation when it comes to infant and maternal mortality rates. Indiana's infant mortality rate is 14% higher than the national average, according to the March of Dimes. And a report from the Indiana Department of Public Health found almost 75% of pregnancy-related deaths in 2019 were preventable.
Unfortunately, what we oftentimes see is that much of what we see in medicine is preventable. For one reason or another, we just don't see that preventative health care across the board like we would like to.
A couple bills aimed at reducing those figures are working their way through the Indiana General Assembly. One makes it easier to add required health screenings for newborns. All newborns in Indiana are screened for more than 50 health disorders. Right now, the legislature needs to approve adding new medical conditions to the required screening list. Lawmakers are hoping to change that, so a panel of medical experts would vet and add screenings to the state's list.
If you wait 2 or 3 months into a child having symptoms of a certain illness, by then the ability to treat that illness and to really affect that child's life will already have been impacted significantly.
Another bill focuses on maternal mortality rates. If approved, the Medicaid income eligibility ceiling would be raised for pregnant women and new moms. The proposal would also extend how long a woman would get coverage after giving birth. Instead of losing coverage 60 days postpartum, a mom would be eligible for coverage for an entire year.
And if we only have that for 60 days, we're really not serving the mom, and by not serving the mom, of course, in turn, we're not serving that new baby. So I think it accomplishes both.
Both of those bills did pass out of the Indiana House and are being considered in the Senate. Reporting in Louisville, Rachel Droz, WHAS 11 on your side.
In Kentucky, the most recent maternal mortality report shows 79% of maternal deaths they reviewed from 2017 were considered to be preventable. That's higher than the CDC's predicted average that 60% of maternal deaths in the United States are preventable. Well, the rate of patients dying during childbirth or the year following birth from complications is one of the highest in the country. These numbers have been going up in Kentucky since 1997. Norton Healthcare's Dr. Lindsay Neese says patients should advocate for their care. If something doesn't seem right, say something.
It's important to attend your prenatal visits. It's important to ask questions and always share with your provider if something just doesn't feel right. If you feel like something is wrong, share it with them.
Dr. Neese says some common warning signs for anybody who has given birth: headaches that won't go away with medicine, bad heartburn that won't go away, or chest pains. If you have any of these, contact your doctor as soon as you can.